In this video, I discuss about the ECG electrocardiogram. The ECG is used to measure a patient's heart's electrical activity. The test is commonly used to check for many heart conditions, from coronary heart disease to a heart arrhythmia. If you are a medical professional, you may find yourself needing to attach the 10 ECG leads to a patient's chest. Out of the 10 leads, 6 are positioned on the patient's chest and 4 of the leads are set on the patient's limb. Although the ECG test is referred to as a 12 electrode test, there are only 10 leads. 2 of the leads contain 2 electrodes each. So, let's take a look at preparation of the patient. Ask the patient to recline on their back. ECG tests are always administered with the patient lying flat on their back. Not only does this position make it much easier to find the correct places to situate the ECG leads, but it also keeps the patient's heart beating at its resting rate. Gain verbal consent to the procedure from the patient. Explain that you are about to place 10 leads on the patient's body to electrically monitor their heartbeat. Clarify that the test will not hurt, but that the leads will need to remain in place for 3 to 5 minutes. Ask the patient to take a few deep breaths and completely relax. Clean the patient's chest before you place the leads. If the patient's skin is dirty or oily, clean it with soap and water and dry with a towel before applying the ECG leads. Dirt and oil can interfere with the electrical readings from the leads. They will also have a much harder time sticking onto a dirty chest. If a patient has a chest hair where the leads should be placed, you will need to shave off the hair. If you don't have a soap and water available, you can also use an alcohol cleaning pad to remove dirt and oil. Now, I discuss the positioning of chest leads. Unpack the ECG leads and read the color coding system. The leads usually in an ECG exam are color coded. There will be a chart on the ECG packaging that lets you know which color corresponds with which lead. The 6 chest leads are magically referred to as the V leads. They are numbered V1 through V6, with V1 being the first lead applied and V6 being the last. The 4 leads that you will place on the patient's arms and legs should also be color-coded. They may be packaged separately from the torso leads to avoid confusion. Find the angle of Lewis to determine chest electrode placement. Set your fingers at the base of patient's throat and slide them slowly down until you feel the top of the sternum. Slide your fingers down across the sternum another 5 to 6 inches, 13 to 15 centimeters, until you reach the sternum's widest part. This is the angle of Lewis. You will know you have arrived at the angle of Lewis when until you feel a bony lump where the 4th rib connects to the patient's sternum. Knowing the location of the angle of Lewis will help you place the ECG electrodes. Having the patient reclining make it much easier to find the angle of Lewis. Place V1 between the patient's rib on the right side of their sternum. Move your fingers to the right of the angle of Lewis. As your fingers slide right, you will feel a gap between the patient's ribs. Slide your fingers down across one more rib until you come to the next gap between ribs. Place the first lead here. To set the lead, press it firmly into place. The leads are lightly adhesive and will stay in the location you put them. V1 should be located between the patient's 4th and 5th ribs, counting down from the top. Set V2 across the patient's sternum from V1. Place your hand back onto the patient's angle of release and this time slide your hand to the left. Find the gap between the patient's ribs and, as with V1, slide your fingers down across one more rib. Set electrode V2 in that gap between ribs, as close to the patient's sternum as possible. V2 should essentially mirror the placement of V1 but on the left side of the chest. Position V4 beneath the midpoint of the patient's left clavicle. From where you just placed electrode V2, slide your fingers down one more rib until you can feel the space between two ribs again. Then slide your fingers to the right. This will be going farther left from the patient's point of view. Place V4 directly under the midpoint of the patient's left clavicle in the space between two ribs. Set V3 directly between nodes V2 and V4. Don't worry about lining V3 up with a gap between ribs. In fact, on most patients' bodies, it will sit directly over a rib, just eyeball half of the distance between electrodes V2 and V4 and stick V3 in that position. If you are working with a female patient, leads V3 through V6 will be positioned beneath, not on the top of, the patient's left breast. Situate V5 at the same height as V4 below the patient's axilla. Slide your fingers right along the gap between ribs. Follow the gap between the patient's ribs where you placed V4. Move your fingers to the right and follow the gap. Move your fingers until they are directly beneath the beginning of the patient's underarm. Press V5 into place here. Set V6 directly under the center of patient's left underarm. Continue moving your fingers to the right, the patient's left, along the line of the gap between two ribs that you have been following. Keep moving until your fingers are directly beneath the center of patient's underarm. Place V6 there, still in the gap between the patient's ribs. It's a good idea to always position the chest leads before positioning the extremity electrodes. The chest electrodes are more important and they need to be much more precisely located. Now, let's take a look at setting of the extremity leads. 1. Lead to the patient's right shoulder below the clavicle. Fix a lead onto the patient's arm on the shoulder above 2 inches 5.1 cm below the patient's clavicle. Press the lead firmly onto the patient's skin to fix its position. If you can't position the lead here for some reason, for example, the patient has a skin lesion, place the lead higher up on the patient's shoulder. You can also place it farther out away from their neck if necessary. The lead for the right shoulder is usually white. Press lead 1 onto the left shoulder below the clavicle. As on the right arm, this lead should fall about 2 inches 5.1 cm below the clavicle. Place the lead at roughly the same location as you place the lead on the right side to ensure that both arm leads give accurate reading. Press down firmly on the lead to fix it in place. If the patient has a defibrillator on their chest and has a pacemaker, don't place the ECG lead on the electrical device. Instead, move the lead 1 inch 2.5 cm in any direction, so it's directly on top of the skin. The lead that goes on the left shoulder is usually color-coded black. Place a lead onto a fleshy spot on the patient's right ankle. You have quite a bit of leeway when sticking the leads onto a patient's ankle, especially when compared with sticking them onto the patient's chest. Aim to place the lead just below the patient's ankle bone where there is a fleshy patch. Avoid placing the lead directly over a bony part of ankle. If the patient is wearing socks and shoes, ask the patient to remove them so you can put on the lead. The right ankle lead typically has a green color. Place a lead onto the patient's left ankle below the ankle bone. Just like with the right ankle, position the lead on the ankle over a fleshy patch. If the patient has a very bony ankle, you could position the lead at the top of the patient's instep. Make sure to position the lead on the left ankle in roughly the same position as on the right ankle. It's more important that the leads be symmetrically positioned, that they be on any exact location on the ankles. The lead that goes on the left ankle tends to be red. There are some warnings that you should remember before starting the procedure. If a patient has an injury or lesion on their skin, don't place an ECG lead over it. Instead, place the lead as near to its intended location as possible, but on healthy, unbroken skin. Second one is, if an ECG lead is incorrectly positioned by as little as 20 to 25 millimeters, 0.79 to 0.98 inches, it can result in a clinically significant misreading of the test.